Being physically active improves our quality of life and helps us live longer. Research shows that physical inactivity and sitting for long periods of time risks our health and well-being. Change is needed to our largely sedentary lifestyles, and this can only be achieved through concerted action of policymakers, researchers, and communities.
HEPA is a networking organization of WHO Europe interested in physical activity promotion. We're made up of researchers, practitioners, and policymakers from 30 European countries with over 200 members.
The mission of HEPA Europe is to provide a forum for the advancement of health-enhancing physical activity research, policy, and practice for better health and well-being across the WHO European region.
Our aim is to try to connect people so that we make sure that the researchers ask the right questions, the policymakers understand the research, and the practitioners help us to deliver for improving physical activity and improving lives.
Policymakers and physical activity researchers, they can learn a lot from each other. For example, policymakers can direct the researchers towards the issues in society that really needs an answer to for example, what are the health benefits or the health risks that we need to take into account.
The research provided by the HEPA network is very useful for us in the national work because it provides the evidence and the knowledge we need to promote physical activity within different sectors, so it's very important.
Non-communicable diseases are main diseases that are contributing to ill health in the WHO European region. They include heart diseases, cancer, diabetes, chronic lung diseases, and physical activity contributes to a significant proportion of those diseases, directly but also through obesity. So if we want to improve health in our region and reduce ill health, improving physical activity is one of the most important aspects.
And here, HEPA Europe, with the help of WHO Europe, is an ideal platform that allows us to share our scientific findings and communicate it to there where then in the end the decisions are being made. It is an ideal platform to come together and think about advocacy for change in Europe.
The HEPA conference is really the cornerstone of the HEPA Europe network. It's our chance to come together as a community, researchers, practitioners, policymakers, and share our work, share our insights into what works to promote physical activity for health.
We must ensure that research and policy come together to ensure that physical activity is ingrained as part of daily life, like I am doing, biking every day, to and from the office. Collaboration and partnerships are essential. Researchers, policymakers and practitioners must collaborate with each other, but also across sectors and with new partners.
So if you're interested in physical activity, in doing research in this space, in making policy in this space, or a practitioner, then you should join. And there are information on our website. Membership is free. All we need you to do is to sign your organization up. If you're interested in physical activity, join HEPA.